Looking for something new and delicious and healthy that's kosher for Passover? Look no further than Dela Rosa's white balsamic glaze, certified kosher for Passover, vegan, gluten-free, and non-GMO. Delicious when drizzled over your grilled salmon, grilled vegetables, chicken, steak, cheese plates, and vanilla ice cream. Made from 3 simple ingredients: white balsamic vinegar, grape must, and potato starch. As with all Dela Rosa products, there are no artificial colors and no sulfites ever added. Dela Rosa always kosher and healthy too. You can find this new product in your local grocery store and on Amazon.com. You can also order by calling 718-333-0333 or by visiting DelaRosa613.com. That's DelaRosa613.com.
And now, thank you for tuning into
You are listening to MD Holistic Healing with Dr. Raphael Kellman, holistic medical doctor and internist, as well as best-selling author. To reach Dr. Kellman, please call 833-MD-HELP-ME. That's 833-MD-HELP-ME. Visit him online at kellmancenter.com. Here now is Dr. Raphael Kellman.
Hello, everyone. Welcome to Holistic Healing. And tonight we have a very fortunate, we have a wonderful guest on, Dr. Alexandra Shustina. Welcome, Dr. Shustina. She's a board-certified gastroenterologist and internist. She holds a graduate degree in molecular biology with a focus on genetic engineering. She has worked in hospitals all over the country, treating emergencies and teaching residents and fellows in medical training programs. Her own health issues have led her to reevaluate her approach and focus on lifestyle and natural therapies. She currently runs a holistic integrated wellness practice in Miami and New York. She's passionate about eradicating disease at its root cause. Welcome, Dr. Shustina. How are you?
Great, thank you. Hi, Dr.
Great to see you. Hi. So tell us what kind of work you've been doing, what kind of patients do you deal with, and what their problems are, and how you treat them.
So, I mean, I really see the whole gamut. Most people find me as a gastroenterologist, so they see me for all sorts of digestive issues. You can hear me, by the way, right? I'm fine. Perfect. So I see everything from what we call irritable bowel in the medical GI community to Crohn's, colitis, reflux. And the truth is I've been seeing more and more of things that are not obviously GI, like autoimmunity, back pain, and a lot of different things that are really rooted in the mind-gut connection, the mind-body connection. And yeah, so it becomes like a very broad practice. I even treat my own dog these days.
So what's your methodology? How do you treat patients with chronic gut issues? Let's say, no specific diagnosis. I mean, the diagnosis of IBS, I mean, we all know is just another word to describe, people's symptoms of gut pain, abdominal pain, diarrhea, constipation. It's really an absurd diagnosis. It doesn't mean anything. It's just a label to those symptoms. So, and absolutely, this is a very common issue. Many people complain of abdominal cramps, pain, discomfort, sometimes constipation, sometimes diarrhea, bloating, sometimes both. So how do you deal with such a problem, and why do you think it's such a common problem?
So, first of all, you're absolutely right in that IBS, or really anything, is a diagnosis that's based on some kind of pattern of symptoms. And we group it together and we treat everyone who has that diagnosis in a similar way. And it becomes a one-size-fits-all kind of medical system. That's the conventional way that I was trained, probably the way you were trained. But the truth is the way that I treat people now is an individual, because even if an individual may have the same or similar symptoms or a pattern of symptoms that may be diagnosed in the same way, doesn't mean their root cause is exactly the same, and it doesn't mean that their treatment plan is exactly the same. So one thing that I do very different now than what I did when I did my training is that I focus on the individual and their root cause rather than on the diagnosis. So
what are some of the root causes?
I look at basically 3 general root causes for all illness, very clearly seen in GI issues. One is the mind-body connection, which any type of emotional stress, old traumas, anxieties. It's a very strong connection between the mind and the gut, which is bidirectional. So there's more connections between the brain and the gut than any other system, the brain and the digestive system more than any other system. And as I think you're very well aware of the microbiome, which is the populations of bugs that live in our gut that also communicate with the brain. So that's the first thing, is the mind gut connection, stress, anxieties, and really even people who are, what we would consider normal mentally, but who've experienced life stressors, traumas that they haven't properly dealt with, can all manifest in the gut. The second thing is food. So our nutrition is generally very poor in this country. Our quality of food is very poor in this country. What we consider a healthy diet by the mainstream is really very poor quality, both quality and quantity. So food is probably the second biggest, or maybe up there with the mind-body connection. And the third is broadly toxins, which can be anything from pharmaceuticals to environmental to surgical to plastics and cosmetics and things like that. So really a very broad term for anything that is chemical, toxic, foreign to the body, that's really very prevalent everywhere. So those are the 3 main broad things that I believe really contribute to the root of all illness.
How do we know that toxins contribute to gastrointestinal function, and what type of toxins are you referring to?
So what I've been seeing most recently is breast implants. For example, there are studies that have shown that both silicone and aluminum, which is found in a lot of the childhood vaccines, and there's a good published data from Israel to show that they are involved in and can cause autoimmune-like patterns, which can also manifest in the gut. So I have been seeing now recently more and more patients with autoimmunity. The autoimmune diseases that I see the most are Crohn's and ulcerative colitis, or inflammatory bowel disease. And I have been seeing patients who have breast implants. Both actually silicone and saline, actually, because the actual, apparently something I didn't know, that even the little bag in which holds the saline is actually silicone. So
how would that affect the gut? What's the connection?
So it creates, it stimulates the immune system. So they're basically considered like an adjuvant, which basically stimulates the immune system, which creates a dysfunctional immune system, which can present as autoimmunity in different places. Doesn't have to be the gut, but I see it in the gut because just by the nature of what I see. So,
but they don't necessarily have an autoimmune disorder like colitis or Crohn's.
Oh, yes, they do actually. So
but what about those who don't have Crohn's and colitis, and they have the typical irritable bowel symptoms? What's the relationship between toxins and those types of symptoms?
So again, it's anything foreign to us, anything that the body is kind of looks at as something that doesn't belong, can create an immune response. Now, an immune response is what causes inflammation. Inflammation is the root cause of all illness, of all chronic illness for sure, and probably a lot of the root cause of some acute illness as well. So it's the inflammation that it can trigger by being a foreign substance that kind of doesn't belong. And that really is so prevalent because a lot of what we use is synthetic, from bottles, like I said, to the air being not clean, to cosmetics, cleaning products, and things like that.
Are there any particular labs that you use to pick up this inflammation? Because they're not common labs.
No, they're not common labs. So I don't. There are some labs that can check for metals and other kinds of toxins, but I don't use them typically. I address each person as an individual, and I take a history. So for example, most recently I have a patient with colitis, and she's been kind of having a pattern of ups and downs in her illness. And she said really she was really like very controlled until she had her breast implants. And she had already consulted with a plastic surgeon. So apparently there are plastic surgeons who are already aware of this. And her plastic surgeon, in fact, is not doing breast implants anymore, but only taking them out. So for me, that historical pattern kind of made it clear to me that this was a major trigger. Now, she had a predisposition to autoimmunity, perhaps, and I think we all have predispositions to something. And like our, genetics load the gun, but environment pulls the trigger. So she had perhaps a predisposition. In fact, she had some manifestations already before that were very mild and controlled. But when she got them, I have another patient with breast implants, actually, who it's coming up recently more frequent now, who has a different type of autoimmunity, like manifested in her joints.
Yeah. So tell us about, foods. How do you know what kind of foods may be causing these types of chronic symptoms? Whether you call it irritable bowel or, abdominal discomfort, diarrhea, constipation, what kind of foods tend to do this? And how do you know what foods are causing problems in a particular person?
Right. So there's some kind of big groups of triggers that are very common. So gluten is generally a problem, and I don't think gluten is evil, and I do think not all gluten is created equal, but the way that our wheat is grown and genetically selected for certain type of kind of high dense gluten product creates a bread that's not so healthy. Now, this is something that I think is different from other countries. So
what makes sense when you say genetically selected, what do you mean?
So it's not genetically modified in the sense that it's like, its gene was inserted or taken out, but in the sense there are certain patterns that were selected for and bred. So kind of like the way we do with dogs, the way we have different breeds of dogs, kind of the dogs that we see now, the Chihuahuas and the Bulldogs, those were not probably the original dog. Probably the original dog looked something like a German Shepherd. But how did they get those species? They took dogs that had certain characteristics that they liked, and they bred them, and they inbred them, and they inbred them. So kind of the same kind of thing. They took characteristics of different plants, and they selected for those plants to grow over the other ones. And this seems like is a big thing that happened in the United States. That didn't really happen so much in Europe and in the Middle East. And that's something actually I'm seeing a lot, that kind of my patients that are more aware of health who are coming from Europe and the Middle East are saying they didn't have issues until they came here. So many people have, I'm sorry.
Well, I'm sorry, do you test for food allergies, food sensitivities?
No. So there are food allergies and food sensitivity. So there is, I know this is kind of a hot topic. Some people do a lot of these tests. I don't. There's the food allergies, like the true allergies, which is the IgE mediated allergies. Most of these are not true allergies. So true allergies would be kind of like a rash or a throat closing up. And then there's food sensitivities. And then I have not found a great correlation between the testing and the food sensitivities. So what I usually do is more of an elimination-based diet. I remove the big triggers and see how people do. Most people usually do better. And then I start reintroducing them in the order of the ones that are best tolerated. And I am able to reintroduce a lot of times gluten and even dairy in different forms, though, in the form of, let's say, sourdough spelt or kamut bread rather than, wheat bread. And many people do all of that, actually.
I mean, there are some people that no matter what you do, they're going to be sensitive to gluten types of bread, period. Whether it's, sourdough or some other that, just some people just, sensitive to it. And there's really nothing you can do about it. So where does the microbiome come in? How do you deal with that? How do you improve on that? How do you test it, et cetera? A lot of people are interested in this. This is a very
Right. So it's a very, very, I think, hot topic. It's, we really, the truth is what we know now is such a small of what the microbiome really has to offer from what I think. We do, so the way that I look at the microbiome is kind of like the interface. Everything before it manifests in the rest of the body manifests in the microbiome. And everything can change the microbiome from our, all the three main things that I listed, which is, life stressors, food, and toxins. So, a lot of people take probiotics, and probiotics are helpful, but really kind of like a, small drop in the vast bucket of the microbiome in terms of what they really do. So the real change of the microbiome happens from the, really treating at the root cause of whatever that person needs, whether it's nutritional changes, the mind-body connection, sleep, exercise, and just really kind of addressing it at the root cause. I don't target any specific thing. I do see, a lot of patients who ask me about stool transplant, fecal microbial transplants, the stool transplants, which are FDA, they're FDA approved for refractory C. diff, and I think they're used off label for very severe colitis, ulcerative colitis. They're extremely effective. So we do know that just changing the microbiome can really make a huge difference. There is a question mark there, and the question mark is we still don't know exactly what is encoded in there 100%. So, there are screenings that they do for donors, but I have seen already a couple of people who had illnesses after their FMTs.
I mean, you don't have to go to such an extreme. There's so many good probiotics, some that are good for diarrhea, some that are good for constipation. There are many, many different probiotics that are particularly good for, cramping and abdominal discomfort. So, I think that the fecal transplants, sometimes people rush to it, and
right, absolutely, yeah,
it's not really necessary. I mean, there's so much you can do with targeted probiotics that could improve the gut, the microbiome in the gut significantly, with significant improvement in symptoms. Because there are all different types of probiotics out there, but you have to know the right ones that help particular types of symptoms and problems. And I think that even in the world of functional medicine, it's really not being addressed properly in terms of the targeted probiotics, using the right ones for particular conditions. But I see very good results with the use of pre and probiotics, targeted probiotics. So I think fecal transplant, people rush to it much too quickly. Anyway, I just wanted to.
I agree. Yeah, I had a patient who would weekly take his girlfriend's stool and make enemas with his girlfriend's stool, and that was his treatment before, and it worked. But yeah, I do agree that.
Yeah. There's also a company that actually produces human probiotics. They get actually the bacteria from humans. Yeah, a very expensive company, but very effective. It's really, it's the only company in the world that I know of that uses human probiotics, and I've seen very good results. The problem is that it's extremely expensive. I mean, it could be as much as $600 or $1,000 for like 2 or 3 months supply, but I mean the results are really staggering. So for some, it's really worth doing. But again, most of the time, gut symptoms can be improved with the proper treatment of the microbiome. I call it microbiome medicine. It deserves to be a specialty in itself, and the right types of probiotics can make a huge difference. I think that the foods, and I'm wondering what your thoughts about this. There are particular types of foods that are specifically good for the microbiome, and do you recommend things like that?
So, like, you mean like fiber-rich prebiotic foods? Is that what you mean?
There are particular foods that are specifically good for the microbiome. That's what some of my books are about, and so are there some foods like that you like to recommend that are particularly good for the microbiome that you like, that you see good results with?
Yeah, so definitely, I think a general, first of all, a generally rich plant-based fiber, which the bugs like to eat, and obviously clean foods like organically grown clean foods. So what in terms of which ones in particular, it depends on where the person is in their course of their health. So for example, like if I have a patient who is very sick, very inflamed, in a flare, like these people really can't have raw fruits and vegetables, for example, like which I love blueberry, all kinds of berries, greens, all kinds of greens, kale, celery, all those things they really can't eat. So they focus more on a cooked vegetable diet, for example, vegetable soups or well-cooked vegetables, generally avoiding the more inflammatory vegetables like white potatoes or tomatoes or some of the nightshades, and more focusing on cooked green vegetables, even some root vegetables. For my kind of more healthier patients who are, healthy, want to get healthier, that this is where like the raw fruits and vegetables can come in, especially berries and green vegetables. I do really like certain non-grain grains like buckwheat, which is actually, I guess, not so common in this country, but in Eastern Europe where I'm from, it's a very common thing. It's like kind of eaten like a hot cereal, but it's not really a grain, it's a seed, a very high fiber, nutrient dense seed. So those are the kind of things I like to have people focus on. I'm not a strict plant-based, I don't recommend a strict plant-based diet. I do think there is room for animal protein, especially high quality animal protein. Most of our animal protein is very poor quality. The animals are stressed, they're unhealthy, and a lot of times we eat the unhealthy animals. So eating a healthy animal is definitely an important thing. I do still think that we eat way too much animal protein. Animal protein is not something that I've seen that really builds the microbiome as much as the plant-based fiber.
Yeah, absolutely. So what are you seeing in terms of COVID, both from the infection of COVID and vaccines,
Right.
and how it's affecting the gut, the microbiome?
So I have actually been seeing, I'm thinking about writing a case reports on this. I'm seeing a whole bunch of GI issues as that seem to be related timely from taking the vaccine. And I think it kind of goes back to the whole adjuvant trigger of triggering the immune system. So I have seen already several cases of stable IBD that was triggered, that was, kind of flared around the same time. I've even seen a patient that never had a diagnosis who presented with a partial small bowel obstruction that was later diagnosed to be Crohn's. I am seeing even gallbladder dysmotility, reflux. I am seeing a lot of GI issues with.
Did you see that as well with people who had COVID?
Yeah, so I am seeing that somewhat as well.
So do you think that more people are getting these problems who've had the vaccine than who've actually had COVID itself?
That's what I'm seeing. I am seeing that more people from the vaccine have these GI issues. Now, again, I don't know if what caused what exactly, but it does seem to be related time-wise from people who were vaccinated and who at that point had different kinds of GI issues afterwards.
So do you think this is another example of where the so-called remedy is worse than the disease itself? Is that?
I do think so, yes. I do think so.
Do you advise people not to get the vaccine who have autoimmune disorders? Or
absolutely.
and what about patients in general? What's your opinion now?
So the patient, unfortunately, many patients haven't asked me. So a lot of my patients didn't ask me, but the ones that do ask me, I tell them that their risk of getting extremely ill from COVID or dying from COVID is very low, which is true for the general population, is about 99%. And for the COVID vaccine, there's so many unknowns as far as we know, and there's already becoming more knowns that are concerning. So as far as the unknowns, long-term data we don't have. It's a new technology that we've never used. And we are already seeing some reports of time-related adverse effects, and some of which are concerning for long-term and short-term. So
like what?
Cardiac issues, inflammation of the heart muscle, like myocarditis, blood clots, questionable fertility issues. Different kinds of inflammatory disorders. Even I've even seen actually worsening dementia.
Oh yes, I see that all the time. What do you think? Well, I have my own opinion, but what do you think the mechanism of action is? What do you think is actually happening? Don't worry, I'm not recording this. The PA is not listening to it, although you never know. They listen to my conversations all the time.
It's fine. I've been public about my opinion. I wish more of us were doing that. I think it's important that there is that freedom and that ability to have diverse.
It's not so much freedom, but anyway, that's another story. I don't know, but I know that I know I'm monitored. I know that. So you do have to be careful and know how to walk this tightrope. But again, what do you think the mechanism is that how the vaccines are doing this, causing all this damage?
So again, we're talking about the COVID vaccine in particular, or just all vaccines in general?
No, with the vaccine.
So with the mRNA vaccine, I don't know that we really know everything about it, or for sure I don't know everything about it. But it just as the concept is that that we're stimulating the immune system in an artificial way, and how that affects us is questionable. We're also introducing a technology with which we've never really used before. So we're using a genetically created injection that has been stabilized with a nanoparticle, lipid bilayer. And the question is, RNA in general is very unstable and just disintegrates, but with this lipid bilayer, we know that it lingers for much longer. So the question is, what does it do afterwards? And the truth is, the mechanism, I don't know the mechanism. I don't know if you know, perhaps, but it does seem that it does artificially stimulate the immune system, which is what a vaccine is supposed to do. It is supposed to create an immune response. So how that manifests in a healthy person, or maybe in a person who has
all vaccines are supposed to do that, to stimulate an immune response. The question is, how is this different in the way it's stimulating the immune system? How is it different?
So there is an adjuvant. It's a brand new adjuvant. I don't know if we know what it's called, or maybe we do, but I don't know. But it is a brand new adjuvant. It's not the typical ones that we've used in the past, most of which it's usually aluminum. In the past, it was mercury. That's definitely one of the ways. So we introduce something that the body would create an immune response to, which is the spike protein, and then we put that together with compounds that stimulate the immune system, so we can get an abnormal immune response. And how that's going to target the rest of the body is really questionable, especially since there was this Japanese study that showed that the nanolipid, the RNA with the nanolipid bilayer travels all over the body, and it goes in every single organ, including the brain, the liver, the kidney, and particularly the ovary. So what does it do there? I don't know that. I definitely don't know all the details. I don't know who does, but I think that the question of it that it could be concerning is something that we all should have.
Yeah, I mean, one thing for sure is that it causes microclots. The
Right.
that's for sure. And those microclots could be everywhere. And you don't pick that up on MRIs or CT
Right.
scans. And there's no doubt people are having TIAs, even strokes, microemboli that you just don't see, cardiac events, and it's quite common. And there's no doubt it's due to the vaccine. But then again, many people got these types of problems and side effects from COVID as well.
Yeah.
The only issue is which one is worse. Which one do you have more negative effects from, and are they different in some way? But I've seen that many patients who have suffered from vaccine-related injuries, if you put them on nattokinase, which is a natural blood thinner that comes from soy, and then a good natural anti-inflammatory, their symptoms mostly resolve, and they could resolve very, very quickly.
Absolutely.
So, which is a good sign, which means that if it's treated appropriately, then perhaps certainly the acute symptoms get better, and perhaps there won't be lingering long-term symptoms. I think that one of the reasons there might be lingering long-term symptoms is because these clots just don't go away, and you're susceptible to vascular disease, for the rest of your life unless you do something about it. I'm using now. I've used exosomes on a number of which come from stem cells on a number of vaccine injured patients, and we're seeing incredible results.
Yeah, I've heard incredible results. Actually, I've heard of that.
We're seeing that, and really the results are amazing. And people get better within a few days. I've seen already around 20 cases of vaccine injured, quite severe, and just with exosomes, like almost miraculous improvement. So there is hope. I think more and more people should do this to prevent long-term complications, to kind of flush it out of your system, and to reduce this rampant inflammation, and there's so much damage done from the spike protein to vessels to organs.
Right.
This kind of rejuvenates it and gets you back to square one. So I hope more and more people come to that awareness that there are things we can do about it, and there's no drug therapy at all that would do anything to get people better. So just about getting the word out about this. So did you deal a lot with patients with COVID, or?
I did, yeah.
And how did you treat them?
So most of them I treated without any pharmaceutical agent, and I treated them exactly the way I treated my other patients. So I have found that many different things. So I mean, I will say that most of my patients are generally health oriented. They're not the ones that are coming to me on a list of 20 medications and are grossly overweight, like in my clinic practice before I was training and right after. So these are definitely different patients, I will say, but at the same time, I think there is a lot to it that is not just does not only need to be treated with a pharmaceutical agent, whether it's ivermectin, which is commonly used, or hydroxychloroquine, or the vaccine. I think a lot can be done. First of all, I think a lot is fear-based, and a lot of people were extremely anxious about this whole situation, which was pumped through the media, TV. Even when you went out of the house in New York, there were signs all over the highway like "Go home, stay home, be scared, lock yourself up." And I think a lot of people were really fear-based. And I think just eliminating that fear was very important in dealing with this. And I had seen actually nutrition was very important at that time, meaning eating very light plant-based foods. And I had actually seen a patient who was doing very well, and then he would do well all day, and then at night he would tell me he would feel terrible. And I asked him what he's eating at night, and he actually 3 a.m. he would eat a meat-based stew. So, and then as soon as he stopped that actually stopped. So nutrition, and then some supplements, and like anti-inflammatory supplements, quercetin, vitamin D, vitamin C, some herbal therapies. I make my own herbs, so different types of herbal combinations that stimulate the immune system, like echinacea-based detox, like burdock root, and other combinations. So most of my patients did extremely well with nutrition, supplements, vitamins, and really, like, you know, having a calm and clear mind, whether that's from meditation, you know, staying away from screens, good sleep, and I found that to be really effective.
Right, right. So let's talk about, you know, your mind body treatments. What are they all about?
So, so I really believe that the mind is, you know, is really where we can create health or we can create illness. And, you know, in our tradition, you know, there are the REs all used to say a lot of our illness is based from emotional issues.
Right.
So there are, and it's already, and we already have the cure. The truth is, I do believe there's many things that people can be doing on a regular basis to create a state of balance in their mind and ultimately a state of balance in their body. And that comes with sleep, exercise, and meditation. And I teach people how to meditate. I have a podcast where I do guided meditations, and I do different techniques in my office with energy medicine that also targets the mind-body connection.
So, and you do these meditations with them in your office?
So in my office, I do targeted energy medicine, which basically a very non-medical holistic approach that I actually learned because of my own health issue. So when I used to have very severe allergies that were very much driven by stress and food. Something I didn't know. I was just finishing my internal medicine residency, starting my GI therapy, and I went to a holistic practitioner in Lakewood. Actually, his name is Jacob Ostevsky, and he cured me in 3 appointments. You know, and I changed my life, and it changed the way I practice. So I realized how much of our health is related to the mind-body connection, and I learned with him this mind-body therapy that's rooted in Jewish traditions and meditation, and that's what I do with my patients. And I also do that in combination with hands-on manipulative therapy with visceral manipulation, cranial osteopathy, because also as something that's in our tradition, in the Chinese traditional medicine, Ayurveda, that we store our emotions in our organs, and the organs, you know, each organ has its own specific emotional pattern that it's connected to. So it's you know, by doing a manual gentle release for these structures, in addition to a mindfulness, it kind of really can have a really major emotional release. And I've had people start crying in my office. You know, it's not like I'm hurting them physically, but it can be very, very powerful. And I think that really demonstrates that how powerful our mind is. And truthfully, people who know how to meditate can really do that on their own. And that's why I really encourage everyone to start meditating. Most people can't get to a point, you know, first day, first week, even first month of meditation where they're actually, you know, healing themselves in a profound way, but practice makes perfect. And I think, you know, making a daily habit of it is really something that can maintain health on a real lasting level.
Oh, this is great. Zeb, let's take a break, and then maybe we could get some callers.
Okay. Those
all
that
right.
are just tuning in, you're listening to MD Holistic Healing with Dr. Raphael Kellman. He's written the book on microbiome. He's written a lot of best-selling medical books, and we have a wonderful guest tonight. And if you need to reach Dr. Kellman, you can call 1-833-MD-HELP-ME, 1-833-MD-HELP-ME. If you'd like to call into the broadcast tonight, you can call us at 212-769-1925, extension 100, 212-769-1925, extension 100. You can email us, info@talklinecommunications.com. or zevbrenner@gmail.com. That's zevbrenner@gmail.com. We're happy to entertain your questions or your comments about that. Again, Dr. Kellman, who's formed the Kellman Wellness Center in Manhattan. He uses the best of traditional medicine and the integrative medicine, holistic medicine, and you can certainly call with any questions. 1-833-MD-HELP-ME. Also has the new TMS machine, which deals with depression and anxiety, also memory loss, and you can call for more information. That's 1-833-MD-HELP-ME. Back to the program we go.
Okay, thank you, Zev. Okay, so this is really fascinating, Dr. Shustina. Your mind-body work and how by touching and manipulating different organs, you see some release. Is there a particular way that you manipulate the organs, and how does it respond?
So there's a whole science behind it. So one of the things that I do a lot is visceral manipulation. So that was kind of the grandfather, the founder of visceral manipulation is a French doctor, Jean-Pierre Barral, who was an osteopath, and he started this whole system based on the concept that all our organs have an inherent motion called motility. And motility, you and I know motility very classically as, the peristalsis in our gut. But the truth is that all the organs have an inherent motility, including the liver, the gallbladder, the kidneys, and even the bones in the skull have a type of motility. So these are all osteopathic kind of terms and the foundation in osteopathic medicine. So the other concept is that all the organs are connected to each other and to other structures. So nothing's free floating. So we have fascial connections. The liver is connected to the colon, to the diaphragm, to the gallbladder. And when we have a stressor to the body, whether it's physical, emotional, even trauma, physically traumatic stressor, we can have a restricted pattern in those fascial connections, which can decrease the motility of those organs. So
how did you learn all of this?
Well, I took courses. I learned, so I'm a DO. So I learned a little bit of this in my in medical school, very, very, on a much lower level, and then I took courses and conferences and I read books and I practiced. I did a whole lot of practicing before I, to see that it really works. You learn it, but then it's like sometimes you're not sure it's real until you really see it. And
also, just hands-on therapy has a healing effect in and of itself.
Absolutely.
What you want to call it, a placebo means just the impact of the mind. I remember not too long ago, I was doing a stress test just for, preventative measures. And I went to a friend of mine, a great cardiologist, Dr. Shimoni. I might as well, brag about him. So I was doing the stress test, and it was really getting difficult. And he just put his hand around me, and boom, I was able to really run and move. And then I realized, coming from a patient perspective, how much it matters having a caring doctor, just hands-on, just touching my shoulders. It gave me so much confidence, and I was able to finish the stress test without any problem. So there's no doubt there's a tremendous, in a good way, a placebo effect just by hands-on care. It's fascinating. Do you think that the liver stores anger?
That's the classical correlation. And if you look in our writings, in our Kabbalistic writings, and you look in traditional Chinese medicine, you look in Ayurveda, it's exactly the same. So there's something to it that's consistent across different cultures. They're saying the same things: anger in the liver, fear in the kidneys.
We have a phone call. Let's go to Rifki in Brooklyn. You have a question for our guest. Go ahead, Rifki in Brooklyn.
Welcome, Rifki.
Rifki, are you there?
Her country, they eat buckwheat for breakfast. That's kasha, right?
Yes.
That's right.
Yeah, what country is that?
So in Eastern
America.
Europe, it's very popular in Russia, Ukraine.
Oh, because my grandparents came from Poland, and it straight down the family till my grandchildren, they eat kasha for breakfast.
Right.
It's
So,
like
you can have cereal. You can
like
have
a tradition. It's like a tradition. And for very young babies, they love it. Babies who are like approaching a year old and they're just starting to eat solid food, they absolutely love it. And,
Right.
and they thrive on it. They do so well with it. But
Yep.
my question is, I recently started having a reflux, and I realized that I'm eating a lot of nuts. So I started looking at the bag of nuts, and I have a bag of cashews, and it says it might have genetically modified ingredients. It has genetically modified ingredients. So I called the company to find out what in the world. All it is cashews that are roasted. What ingredients did they put in it? So they sent me back a message that it might be roasted in cottonseed oil, and
That's not
cottonseed oil is genetically modified. Have
Right.
you?
Yes.
Well, first of all, you don't want to roast anything in that type of oil. Right away, you're creating, free radicals, and it's it's an omega-6, which is inflammatory. So it's a double whammy. It's really not a good thing to eat. And we are overloaded with omega-6, and that's crowding out the healthier omega-3s. So you got to be careful with those types of foods. They're inflammatory, and that's what you were mentioning before, doctor, that these subtle toxins, in the end, they build up and they cause problems.
What?
Yeah, be careful. Don't eat
the cashews or the oil?
Well, the oil.
Oil. But the
Yeah.
cashews, if it would be dry roasted or something like that, wouldn't be
Get
a problem.
Get it dry roasted. Yeah.
Right.
Yeah.
Wouldn't be a problem.
Yeah, exactly. Well, thank you for calling. Thank you. Good question. Good question. I'm glad you called them. You must have free time on your hands. Are you able to? Because they must have put you on hold for a long time. So anyway, every Shabbat morning, and I think our listeners will be interested in it. We say, "B'chol levavot yiraucha, b'chol kerev uchlayot yizamru l'shmecha." That we say, our hearts, we know, should fear you, but also it's related to love. And then also our kidneys and feelings and thoughts shall sing praises to you. And then it says, Kol atzmotai tomarna, my bones will say, Hashem bichamocha, God who is like you. So, and of course, Art Scrolls translates it not literally. They say here, and all innermost feelings, instead of the literal translation of the kidneys. So how do you explain this? How would you translate this? I imagine more literally. And do the kidneys sing praises to Hashem's name, to God's name? Is that what
this might be above my my level, but it makes sense what you're saying because the organs are very much related to feelings and emotions and intuition, and so it makes sense what you're saying. So there's a positive and a negative aspect. For example, the kidneys. This is definitely not a medical conversation. We're taking it to a different level, which I'm so excited to do. But it's the kidneys are also their fears on one level, which is so prevalent, and on the other level, the kidney energy has a lot to do with intuition, and people who are generally sensitive in a good way are also intuitive, and that they may have sensitive kidneys, so they need to watch what they eat, what they drink. So I think it's probably related to something on that level. I'm probably really taking this to a much much less complex, less sophisticated than what you're reading. But if you're asking me from what I know, I mean, that it does resonate with what I.
I had a patient, and as I'm quoting this, I had a patient, he was an Orthodox religious person, and his GFR was quite low, which means kidney function.
Right.
And that's because I read him this pasuk, and I told him to start singing more to Hashem, to God, and your kidneys will get better. Now, he did a bunch of things. So I don't know if that was it that made it better, but it certainly didn't make it worse. And what's interesting is that, in the heart, you have receptors for taste, for smell, and it's unbelievable. Like, what are these receptors, olfactory receptors, and taste receptors, and even visual receptors are in the heart.
Really?
It's unbelievable. So it shows you that on deeper down, the heart is not just a mechanical pump. It's not just the heart of Harvey, who
Right.
showed us that it's a mechanical pump. That there's many other layers, and the metaphorical understanding of the heart is not just metaphor. It's real, and so it's and then also there are all kinds of receptors deep inside the gut for smell and for sight, and it's just amazing. Like, what are these receptors doing in there? So it shows you that there's so many layers of function, and in modern medicine we're only dealing with a very, very superficial layer, but the deeper you go down, the more mysterious all these organs become. And of course, the ancient traditions understood this, and and certainly tried to address health from that perspective. I mean, it's well known that anger and hostility certainly makes your risk for cardiovascular disease worse. It certainly is, you're more likely to have cardiac events if you already have atherosclerosis. So there was even some studies to show that people who use more self-oriented words like me and I, they're always talking about themselves, have an increased risk of heart disease, and if they have heart disease, have an increased risk of having coronary events. And this doesn't mean that this is obviously not the only cause, but it's certainly a contributing factor. It is a great book that I skimmed through called the Rabbit Effect. And there's a bunch of studies that they fed rabbits diets that will absolutely cause coronary artery disease with all kinds of crappy foods. And yet there was one group in the study where they took good care of them, they petted them, and they showed love to them, and they had no signs of atherosclerosis. Zero.
Amazing.
The other group riddled with atherosclerosis. Now, and that's on an animal level. So, but it's you see more of the effects on an animal, small animal, but it also applies to humans too. It's a little bit watered down. You don't see it as much, but if you look closely and the studies are done accurately, you'll see it in humans as well. Sense of altruism and sense of community all play a role in. These are the soft data that really should play a more prominent role in terms of the algorithms of understanding of health and disease. So it's very interesting that we that you do this type of work. I think it's very progressive. You should start singing with your patients praises to God, and do a study and see how well they do.
Yeah, sounds great.
Yeah, very nice. So we have a few minutes left. How do people get in touch with you, and where are you located?
So I am in between Miami and New York, but they can call my office.
You work in both places? How do you swing that?
So I was living and working in New York, and then in March of 2020, I was forced to shut down, and I switched to telehealth. And then I was able to continue seeing my patients via telehealth, and I go back to New York periodically and see the ones that need to be seen in person, and I maintain them via telehealth, and I have an office here in Miami too. So
how do people
between those two, I'm able to balance it out.
What's your website?
It's www.wholegut, WHOLEGUT.com. Whole Gut, like Whole Foods, but wholegut.com. And the office number is 212-634-4233.
Terrific. Dr. Shustina, thank you for coming on. This is great.
Thank you so much. Such a pleasure.
All right. And we'll see our listeners next week. We'll have some more interesting guests.
Okay.
Everyone.
Wonderful night. Thank you.
Thank you, Doctor.
The Kellman Wellness Center is one of NYC's first locations to offer the brand new Emsculpt Neo treatment. Emsculpt Neo is a fast, painless, non-invasive, FDA-approved treatment that reduces up to 30% fat from your abs, buttocks, legs, and arms, and increases healthy muscle mass up to 25%. Get the tight abs you've always wanted. Book your treatment today and get a special introductory offer. Call the Kellman Wellness Center at 833-MD-HELP-ME. 833-MD-HELP-ME.